Vital signs are like windows into the body's overall health. They provide critical information about a patient's well-being. These measurements offer insights into various bodily functions. Understanding vital signs is crucial for healthcare providers. It allows for quick assessment and informed decisions about patient care. Monitoring vital signs helps detect early warning signs. This is especially important in emergency situations. Changes in vital signs can indicate a worsening condition. Therefore, healthcare providers must be able to measure and interpret these signs accurately. This skill enables timely intervention and potentially life-saving measures. Blood pressure measures the force of blood against artery walls. It is recorded as two numbers, systolic and diastolic. Systolic pressure is the higher number, reflecting the heart's contraction. Diastolic pressure, the lower number, represents the heart at rest between beats. Accurate blood pressure measurement is essential for diagnosing and managing hypertension. To measure blood pressure, use a sphygmomanometer and a stethoscope. Wrap the cuff around the upper arm, slightly above the elbow. Place the stethoscope's diaphragm over the brachial artery. Inflate the cuff until the pulse disappears. Slowly release the pressure while listening for the first Korotkoff sound, which indicates systolic pressure. Continue deflating until the sound disappears. This marks the diastolic pressure. The pulse reflects the heart's rhythm and the number of times it beats per minute. It can be felt at various points on the body where arteries are close to the skin. The most common site is the radial artery on the wrist. Other pulse points include the carotid artery in the neck and the brachial artery in the elbow. To measure pulse rate, gently press 2 fingers on the chosen pulse point. Count the number of beats you feel for 15 seconds. Multiply this number by 4 to get the pulse rate per minute. Note the rhythm, whether it's regular or irregular. Any irregularities should be reported to a physician. Respiration, the process of breathing, involves inhaling oxygen and exhaling carbon dioxide. The respiratory rate reflects the number of breaths a person takes per minute. Counting respirations should be done discreetly to avoid altering the patient's breathing pattern. Observe the rise and fall of the patient's chest to count respirations. Each rise and fall represents 1 breath. Count the number of breaths for 1 minute. If the patient is aware you're counting, their breathing may become faster or slower than usual. To avoid this, pretend to be checking their pulse while subtly observing their chest movements. Taking temperature, a gauge of health. Body temperature is a measure of the body's internal heat. It can be taken orally, rectally in the ear, or on the forehead. Oral and tympanic temperatures are common and convenient. Rectal temperature is considered the most accurate but is more invasive. When using a digital thermometer, ensure it's clean and properly calibrated. For oral readings, place the thermometer under the tongue. For tympanic readings, gently insert the probe into the ear canal. For forehead readings, sweep the thermometer across the forehead. Always follow the manufacturer's instructions for accurate results. Height, weight, and pain. Completing the picture. Measuring height and weight is crucial for assessing growth, development, and overall health. Height is measured using a stadiometer, and weight is measured using a scale. Ensure accurate readings by calibrating the equipment and having the patient stand straight with shoes removed. Pain assessment is subjective but essential for understanding a patient's discomfort level. Use a pain scale, such as a numerical rating scale from 0 to 10 or a visual analog scale to assess pain intensity. Ask open-ended questions about the location, duration, and characteristics of the pain. Conclusion: vital signs in a nutshell. Mastering vital signs is fundamental for healthcare providers. It enables us to gain a rapid yet comprehensive understanding of a patient's condition. Accurate measurement and interpretation of these signs are crucial for early detection of potential problems, allowing for timely interventions and improved patient outcomes. Learn more with Apogee Healthcare Institute. Interested in expanding your knowledge and skills in healthcare? Visit Apogee Healthcare Institute for a wide range of courses and resources designed to enhance your expertise. Join us today and become a part of our vibrant learning community. Please like, comment, share, and subscribe to the channel for more how-to videos.